Today I'm going to demonstrate how to do self-release on hip flexors muscles. They are tricky to get into, but it is still possible to do within your home environment. You would need to have some equipment, and I'm just going to demonstrate how to do it. The easiest point of access to this muscle is going to be located around your belly button. So to do that, you have to first find your belly button and then kind of measure 1 inch towards one of the sides. Let's do the right side in this case, and then 1.5 or 2 inches lower down here. So it's going to be located in this area over here, but I'm gonna go on the floor and demonstrate how to locate it and palpate it properly. In my example today, I'm going to be using a tool. So I'm going to be using the muscle roller. It's basically a stick which you use to roll your muscles. The reason I like it because it's not too long. It has a dull edge over here, a dull end, which you can actually submerge or like press into the stomach to do the self-active release technique. If you don't have a stick like this at home, you can use anything else like long enough, but the edge is supposed to be dull so you don't hurt yourself. I would recommend to put a tennis ball in it. You can cut the hole in the tennis ball and just put it on top and then get into your hip flexors. To perform the technique properly, I would recommend to get on the floor, on the yoga mat, but wear the socks and preferably that the surface would be smooth like a hardwood. This will help to perform the self-release technique. So you get on the back first. Then you have to bend your knees so the feet are on the ground. So we are working in the abdominal section, and bending your knees helps to release a bit of tension in the core over here. So like I said before, you have to locate the muscle so you get inch away from the belly button, couple inches down. So it's supposed to be around this area here. If it's tight enough for you, it will be like a rope little kind of arch that you're gonna really feel. So to make sure that you actually own it, what you have to do is you have to lift the same side leg basically. In my case, it's the right side. So what I have to do is just to slightly lift it up, just to lift the foot off the ground, and you can feel that the muscle just pop up. You can feel like it becomes nice and taut. So if you feel that, it means you are on the right spot, you're right on the right location, and you can perform the self-release from this point. So just keep your hands in there. You can replace your hands just to get the tool. Then you replace your fingers with the tool. So you want to go just a bit, maybe like 20-30 degree, like inwards. So you don't really do the vertical like 90 degree because you're going to be working with the rectus abdominis muscle. It's not the case. We need to get a little bit on the angle. Again, don't press too hard because it could be a bit painful, and just to make sure that you're on the right spot, again, you can lift the leg a little bit, just lift it above the ground, and you can see like, yes, the muscle's pressing right into the stick. So what you do here, you have to apply a bit of pressure on the top of the stick. If it's too long, you cannot reach, you can get just like right on the stick itself, the hand on the stick. Compress gently until you feel this good enough pressure, maybe 7 out of 10, so not to hurt yourself too much. And apply the pressure, and as you do so, take a nice deep breath in, and as you breathe down, you're supposed to slide your foot on the ground and straighten up your legs. So it goes like this. So if the muscle is a bit too tight, it could be quite uncomfortable. There also could be gas in the intestine, so you might feel a little bit bloaty and like it's really sharp. You can reposition the stick like maybe higher or lower just to get that away from that pocket. And the pressure on the stick is it's consistent. I'm not trying to press more harder as my leg goes down. It's the same pressure, so I would let the muscle get used to the pressure, get used to technique, and the breathing also helps to relax, and it's easier, like it gives you the flow. It's easier to let go of the leg, and so it's kind of slides down and relaxes. So you can repeat this technique about 3-5 times. Don't rush yourself, listen to your body, and probably by the 5th time you will actually feel it's getting much looser. So it's also a bit of practice. It takes a bit of time for the body to adjust, to the mind to adjust, and you can also shift the position of the stick a bit higher up, a bit lower down, because muscles, like I said before, it's quite long, and you also want to release, like you have to find the most taut spot, like a trigger point basically, and you just want to work on that. There's other techniques you can do, is like just same kind of approach. You apply the pressure, then what you do is just kind of wiggle your leg around. You find like, you know, if the letting leg down is a bit too difficult, a bit too hard, you can do a bit of like movement of the same leg. What this does, it kind of creates a bit of friction, also helps to release and loosen up the fibers. But this active release technique, it's only working whenever you're actually stretching the muscle. In this case, with the pressure application, you just breathe and breathe out, and breathe out and stretch, and it is very quite effective. So this technique is quite painful, and if you're not sure about your the muscle locations, it's better not to do it and let your health professional do it for you.